There is a seed so small that you could hold 1,000 of them in the palm of your hand, and yet this one tiny seed has the ability to relax blood vessels, improve circulation to every organ in your body, and restore something that millions of men over 50 quietly struggle with every single day. And no, this is not some exotic superfood from a remote jungle. This is something your grandmother probably had sitting in her kitchen cabinet. But here is the part that really surprised me. When researchers finally studied what this seed does inside blood vessels, they discovered a mechanism so powerful that it mirrors the same pathway used by some of the most prescribed medications in modern urology. Naturally, without a prescription, without side effects. And today I am going to walk you through exactly how it works, why it works, and how you can start using it the right way. Stay with me because this is going to change the way you think about your health after 50. I am Dr. Olivia Brooks, and I have spent years in clinical urology helping men understand what is really going on inside their bodies. And one of the most common things I hear from men who walk into my office is this. They say, "Doctor, everything was fine until about 2 years ago. And then things started to change. Their energy dropped. Their confidence took a hit. They noticed that their physical vitality was not what it used to be." And some of them, the honest ones, they look me straight in the eye and say, "I feel like my body is shutting down." And I always tell them the same thing. Your body is not shutting down. Your blood vessels are tightening up. And that is a very different problem with a very different solution. You see, here is something most men do not realize. Almost every concern that brings a man over 50 into a urology clinic, whether it is trouble with urinary flow, difficulty with physical performance, problems with stamina, or issues with intimate function, almost every single one of those concerns traces back to one root cause: blood flow. That is it. Blood flow. When your blood vessels are open and relaxed and flexible, blood moves freely to every organ. Your kidneys work better, your prostate stays healthier, your intimate function stays strong, your energy stays high. But when those blood vessels start to narrow and stiffen, and they do as we age, everything downstream begins to suffer. Your body does not suddenly forget how to function. It just stops getting the fuel it needs. And that fuel is blood. Now, before I go any further, if you are watching this and finding value in what I am sharing, do me a quick favor. Hit that like button, subscribe to this channel, and drop a comment telling me where you are watching from. I read every single comment, and I love hearing from men all around the world who are taking charge of their health. Your engagement helps this channel reach more men who need this information, and honestly, it means the world to me. All right, let us keep going because we are just getting started and the best part is still ahead. So let me tell you a story. About 4 years ago, a 62-year-old man came to see me. I will call him Richard. Richard was a retired engineer, sharp mind, strong build, the kind of man who built things with his hands his whole life. But when he sat down in my office, he looked defeated. He told me that over the past 18 months, his intimate life with his wife had essentially disappeared. Not because he did not want to be close to her. He did, but his body was not cooperating. He had tried a couple of things his regular doctor suggested. They helped a little but came with headaches and other discomforts. And he said something I will never forget. He said, "Dr. Brooks, I do not want a pill that forces my body to do something. I want to understand why my body stopped doing it on its own, and I want to fix that." That question changed the entire direction of our conversation. Because Richard was asking the right question. He was not asking for a Band-Aid. He was asking about the root, and the root, as I explained to him, was vascular. His blood vessels had become less flexible over time. Plaque had started to build. The inner lining of his arteries, a delicate layer called the endothelium, was not producing enough of a critical molecule. A molecule called nitric oxide. Now let me pause here because this is where the science gets really interesting and really important. Nitric oxide is a tiny molecule that your body produces naturally. Its job is simple, but absolutely essential. It tells your blood vessels to relax and open up. When nitric oxide levels are healthy, your arteries dilate, blood flows freely, and every organ from your brain to your heart to your pelvic region gets the oxygen and nutrients it needs. But here's the problem. After the age of 40, your body starts producing less nitric oxide. By the time you reach 60, some studies suggest your nitric oxide production may have dropped by nearly 50% compared to when you were in your 20s. And that decline does not announce itself with a loud alarm. It sneaks up on you. A little less energy here, a little more difficulty there, slower recovery after exercise, changes in intimate function that you chalk up to just getting older. But it is not just aging, it is a measurable biochemical decline. And once you understand that, once you see the mechanism, you realize that the solution is not about fighting age. It is about supporting the chemistry that keeps your blood vessels young. And that brings us to this tiny seed. The seed I am talking about is the flax seed, small, brown, or golden, unassuming. You have probably walked past it 100 times in the grocery store without giving it a second thought. But inside that little seed is one of the most powerful natural compounds for supporting blood vessel health that science has ever studied. And I am not saying that lightly. The research behind flaxseed and vascular function is robust, peer-reviewed, and genuinely impressive. So let me break down exactly what flaxseed does inside your body and why it matters so much for men over 50. The first thing you need to know is that flaxseed is the richest plant source of something called alpha-linolenic acid, or ALA. ALA is an omega-3 fatty acid. Now, you have probably heard about omega-3 from fish oil, and yes, fish oil is beneficial. But what many people do not realize is that ALA from flaxseed works through a slightly different but equally important pathway. When you consume ALA, your body uses it to support the health of your endothelium, that delicate inner lining of your blood vessels I mentioned earlier. The endothelium is where nitric oxide is produced. When your endothelium is healthy, it produces more nitric oxide. When it is damaged or inflamed, production drops. ALA helps protect the endothelium from oxidative stress and inflammation, which are two of the biggest enemies of nitric oxide production as we age. But here is where it gets even more interesting. Flaxseed does not stop at ALA. It also contains the highest concentration of compounds called lignans found in any food on the planet. And lignans are remarkable. They function as powerful antioxidants inside your vascular system. Think of them as tiny bodyguards that patrol the walls of your arteries, neutralizing the free radicals that cause damage and stiffness. Multiple studies have shown that lignin-rich diets are associated with lower blood pressure, reduced arterial stiffness, and improved endothelial function. And all three of those things translate directly into better blood flow throughout your entire body, including the pelvic region, which is of course critically important for urological and intimate health. Now let me tell you what happened with Richard, because his story is the perfect illustration of why this matters in real life, not just in a laboratory. After our conversation about nitric oxide and vascular health, I did not hand Richard a prescription. Instead, I gave him a plan. Part of that plan included adding ground flaxseed to his daily routine, not a supplement, not a capsule, just whole ground flaxseed, 2 tablespoons a day, mixed into his morning oatmeal or blended into a smoothie. I also asked him to walk 30 minutes a day, reduce his processed sugar intake, and drink more water. Simple changes, nothing extreme. Richard came back to see me 12 weeks later, and the man who walked into my office was not the same man who had sat there looking defeated 3 months earlier. His blood pressure had dropped 8 points on the systolic side. He told me his energy was noticeably better, he was sleeping more soundly. And then he got a little quiet, and he smiled and he said, "Dr. Brooks, things are working again. And I do not mean just a little bit, I mean really working." My wife noticed too. She asked me what I changed. Now I want to be clear about something. I am not telling you Richard's story to promise you that flaxseed is a miracle cure. It is not. No single food is a miracle cure. But what flaxseed does, and what the science supports very strongly, is that it helps create the internal environment your body needs to restore healthy blood flow. It supports nitric oxide production by protecting the cells that make it. It reduces the inflammation that damages your arteries over time. And it provides the essential fatty acids that keep your vascular system flexible and responsive. There was a landmark study published in the journal Hypertension that I want to share with you because it really drove home just how powerful this little seed can be. Researchers took a group of patients with peripheral artery disease, a condition where blood flow to the limbs is restricted due to narrowed arteries. They gave half the group 30 grams of milled flaxseed daily, about 2 tablespoons, mixed into their regular food. The other half received a placebo. After 6 months, the flaxseed group showed a significant reduction in blood pressure, one of the largest reductions ever observed in a dietary intervention trial. Systolic pressure dropped by an average of 10 millimeters of mercury. To put that in perspective, that is comparable to what some blood pressure medications achieve from a seed, a tiny, natural, affordable seed. And here is the detail that makes this especially relevant for men watching this video. Systolic blood pressure is directly linked to arterial stiffness. And arterial stiffness is one of the primary reasons men over 50 experience declining intimate function. When your arteries are stiff, they cannot dilate properly. When they cannot dilate, blood does not flow where it needs to go, when it needs to get there. By reducing arterial stiffness, flaxseed supports the exact mechanism that drives healthy, intimate performance, the very same mechanism. Now you might be wondering, how do I actually use flaxseed the right way? Because there is a right way and a wrong way, and the difference matters quite a bit. First, you want to use ground flaxseed, not whole flaxseed. This is critical. Whole flax seeds are very hard, and your body cannot break them down properly. They will pass right through you without releasing their beneficial compounds. You need to grind them first. You can buy pre-ground flaxseed, which is sometimes labeled as milled flaxseed, or you can buy whole seeds and grind them yourself in a coffee grinder. It takes about 10 seconds. Second, store your ground flaxseed in the refrigerator or freezer. The omega-3 fats in flaxseed are delicate. They can oxidize and go rancid if left at room temperature for too long. Keeping them cold preserves their potency. Third, start with 1 tablespoon a day for the first week and then increase to 2 tablespoons. Some men experience a little digestive adjustment when they first add flaxseed to their diet because it is very high in fiber. Starting slowly lets your gut adapt comfortably. And fourth, the best way to consume it is mixed into food. Sprinkle it on oatmeal, blend it into a smoothie, stir it into yogurt, mix it into a salad dressing. It has a mild, slightly nutty flavor that blends easily into almost anything. You will barely notice it is there, but your blood vessels will absolutely notice. Now, here is something I want to address because I think it is important. Some men hear about natural approaches like flaxseed, and they think, well, if it is just a food, how effective can it really be? And I understand that skepticism. We have been conditioned to believe that real solutions come in prescription bottles and anything natural is just wishful thinking. But I want to challenge that assumption because the science does not support it. The endothelium of your blood vessels does not care whether a molecule came from a pharmacy or a kitchen. It responds to chemistry. And the chemistry inside flaxseed, the ALA, the lignans, the fiber, those compounds trigger real measurable biochemical responses inside your vascular system. Does that mean you should throw away your medications? Absolutely not. If your doctor has prescribed something for blood pressure or for any other condition, you keep taking it and you have a conversation with your doctor before making any changes. What I am saying is that food is not an alternative to medicine. Food is the foundation upon which medicine works better. When you give your body the raw materials it needs to support healthy blood vessel function, everything else you are doing for your health becomes more effective. Your medications work better. Your exercise produces better results. Your sleep improves. Your stress levels come down. It is a compounding effect, and it starts with something as simple as 2 tablespoons of ground flaxseed every morning. Let me share one more piece of the science that I find truly fascinating, because it connects flaxseed to prostate health, which is obviously a major concern for men in this age group. Chronic inflammation is one of the key drivers of prostate enlargement, also known as benign prostatic hyperplasia, or BPH. When the prostate tissue becomes inflamed over time, it swells, it presses against the urethra, and that is when men start experiencing those frustrating urinary symptoms. The frequent trips to the bathroom at night, the weak stream, the feeling that you cannot fully empty your bladder. The lignans in flaxseed have demonstrated anti-inflammatory properties specifically relevant to prostate tissue. Several studies have explored the effect of flaxseed supplementation on prostate health markers, and the results have been encouraging. Reduced inflammation, slower cell proliferation, better overall prostate biomarker profiles. Does this mean flaxseed cures BPH? No. But does it mean that including flaxseed as part of a prostate-healthy diet is a smart, evidence-based decision? Absolutely yes. And when you combine the vascular benefits with the anti-inflammatory benefits, you start to see why I call flaxseed one of the most underrated tools in men's health. It works on multiple levels simultaneously: blood vessels, inflammation, prostate tissue, cholesterol, blood pressure, all from one tiny seed that costs a few dollars for an entire bag that lasts weeks. I had another patient, a 57-year-old man I will call James. James came to me not for intimate concerns, but for urinary issues. He was getting up 4 and 5 times a night to urinate. His prostate was moderately enlarged, but not severe enough for surgical intervention. He was miserable. His sleep was wrecked, and his daytime energy was non-existent because of it. We implemented a comprehensive approach that included dietary changes, pelvic floor awareness, fluid timing strategies, and yes, daily ground flaxseed. Within about 8 weeks, James was down to 1 or 2 nighttime bathroom trips. His PSA remained stable. His energy came back because he was finally sleeping through most of the night. And he told me something that stuck with me. He said, "Dr. Brooks, I spent 3 years thinking this was just what getting older meant. I wish someone had told me sooner that I could actually do something about it." And that is exactly why I make these videos. Because too many men accept decline as inevitable when so much of it is modifiable. Your body is not failing you. In many cases, you just have not given it what it needs. Now I want to take a moment to talk about something that does not get discussed enough, the emotional side of all this. When a man's intimate function declines, or when he is dealing with embarrassing urinary symptoms, it does not just affect his body. It affects his confidence. It affects his relationship. It affects how he sees himself. I have had men sit across from me in tears, not because they are in physical pain, but because they feel like they have lost a part of who they are. And I want every man watching this to hear me say this clearly. You have not lost anything permanently. Your body has an extraordinary capacity to heal, to adapt, and to improve when you give it the right support. This is not about going back to being 25. This is about being the strongest, most vital version of yourself at the age you are right now. And that is an achievable goal. I see men achieve it every single week. Flaxseed is one piece of that puzzle. It is not the only piece. Exercise matters, sleep matters, stress management matters, hydration matters, regular checkups with your doctor matter. But in terms of a simple, affordable, scientifically supported change you can make starting tomorrow morning, adding ground flaxseed to your daily routine is one of the most impactful things you can do. It supports the nitric oxide pathway that keeps your blood vessels open. It fights the inflammation that damages your prostate and your arteries. It provides essential fatty acids that your body cannot make on its own. And it does all of this gently, naturally, and without the side effects that make so many men reluctant to seek help in the first place. Let me also mention one more benefit that often flies under the radar. Flaxseed is one of the best natural sources of soluble fiber, and fiber plays a hugely important role in managing cholesterol levels. High cholesterol leads to plaque buildup in your arteries, which further restricts blood flow. By helping to lower LDL cholesterol, flaxseed is protecting your vascular system from yet another angle. It is like having a multi-tool for your cardiovascular and urological health all wrapped up in one tiny package. I want to leave you with a thought. Every day, your body is either building health or losing it. There is no neutral. Every meal, every glass of water, every walk around the block, every night of quality sleep pushes the needle in one direction or the other. And the beautiful thing about understanding how your body works, understanding the role of nitric oxide, understanding how blood flow drives function, understanding how inflammation drives disease, is that it puts the power back in your hands. You are not a passive observer of your own health. You are the architect, and sometimes the most powerful changes start with the smallest steps. A tablespoon of ground flaxseed in your morning oatmeal, a 30-minute walk after lunch, an extra glass of water before bed. These are not dramatic interventions. They are quiet, consistent, compounding decisions that add up to profound change over time. Richard knows that now. James knows that. And now you know it too. If this video helped you, if it gave you one new insight or one moment of hope, then please share it with a friend, a brother, a father, or anyone you know who might be quietly struggling with these same concerns. Men do not always ask for help, but sometimes when the right information finds them, it changes everything. Hit that subscribe button so you do not miss the next video where I'm going to talk about another natural compound that specifically supports prostate health in a way that most doctors never mention. Trust me, you do not want to miss that one. This is Dr. Olivia Brooks reminding you that your best years are not behind you. They are being built right now, one smart choice at a time. Take care of yourself, gentlemen. You are worth it. Disclaimer: this content is for educational purposes only and does not constitute medical advice. Always consult your physician before making changes to your diet, supplement routine, or treatment plan. Individual results may vary based on personal health conditions,